Welcome all to our November Health and Wellbeing. For those who have joined us virtually, for those in the room, and those who are watching us on YouTube. My name is Wax. I'm the NEL Chair, the North East London Chair for Newham, and co-chair with Mayor Fires for the Health and Wellbeing Board. If I start with apologies for absence.
Thank you, Chair. Apologies from Althea Lodrick, the Council's Chief Executive, with Colin Ansell representing. Apologies from Dr. Andrew Kelso, Medical Director of the NUH, with Adam Seale-Jones representing the hospital. Apologies from John Rook, who I've noticed is on screen, and from Geeta Subramaniam Muni, Corporate Director of Brighter Futures CYP as Commissioner. Thank you, Chair.
Thank you. John, what are you apologising for? You're here.
There's many sins to repent.
I don't see it.
Okay.
Chair, I'm also here if that's helpful. Geeta.
Yeah, I was just looking around there. Yeah, Geeta, you're there as well. Welcome. Excellent. Brilliant. Declarations of interest. If there isn't anything urgent, I'm going to move to minutes. Item 3, pages 9 to 28. If I give everybody a few moments to collect their thoughts, are people happy for me to approve those as a correct record?
Agreed, Chair.
If I could then just give everybody an update. So for item 7, my understanding was there was to be a data pack. What we will do for item 7 is to concentrate on some highlights, and the full item and the information will be circulated following the meeting. Is there any timelines on that, Jason? Or
Sorry.
Item 7.
Be directly after.
Directly after. And then the item for the Better Care Fund, we'll take that with item 10 with the any other urgent items. So if we could go to 4, which is the oral health update. John, are you taking that for us?
Yeah, so it'll be myself and Ashley.
Over to you, John.
Thank you. So I think I'll start by recognising the long-standing work of Health Watch in raising the issue of oral health in the borough on behalf of residents, and that's really important because we're consistently hearing those voices through Health Watch and about this being a priority. So thank you to colleagues from Health Watch. And increasingly, we wanted to give ourselves more data on oral health, and in particular in dentistry. So recent activities have been twofold, and Ashley will touch in a second on some of the health promotion work we've been doing around this, which has been really impressive. But we've been trying to get greater degrees of data around the provision of dentistry and the impact of COVID on dentistry. And we invited tonight representation from NHS England, who I don't think have joined us. We made the invitation for them to come. They did provide us with some data, and we've asked some supplementary questions which we've not yet got resolution to. So there's further work to do with the Commissioners of Dental Services from NHS England, particularly as we work out how well provided Newham is. And you can see in the paper and some of the graphs, you can see some of the relative levels of units of dental activity delivered for the population versus London and England, which want to make those comparisons as well. And you can also see within your papers and in the tables and graphs some of the impact of COVID and how NHS England is instituting, as the Commissioner, a recovery plan in stages. And the stage we're in at the moment, they refer to as a crisis phase because of the significant impact in how dental services can be operated with the infection control policies of the time. So you can see it's quite a long period of time before we recover where we need to get to in terms of that provision. You can see the potential link between planned and urgent dental access for the residents of Newham as well. So maybe because of the level of planned services, and this requires further investigation, we're seeing more urgent treatment come through. So as I said, we've got further questions to ask particularly interested in what's happened to the pattern of provision, whether we have increased levels of private versus NHS access in the borough as well, which we are still seeking to get data on. But I think what I would highlight is a reasonable start in getting some information that can inform how we plan and support local residents to access dentistry, recognising the limitations still on some of those services. So I'll hand over to Ashley to talk about the health promotion work we've been doing.
Evening, everyone. My name's Ashley. I'm a senior public health strategist in the public health team, and we really recognise the importance and value of preventative health measures within this space, particularly at a time where, as John mentioned, there has been a significant reduction in more clinical-based services. So one of the things that we decided to do at the beginning of this year was set up a borough-wide oral health partnership group, and this was designed to bring in key partners that play a role in the oral health system of Newham to better understand each partner's roles and responsibilities in this space. But for the purpose of what I'm presenting on today, it was to also map out what the oral health promotion offer currently is in the borough. So we've now mapped that out, and as you would be able to read under section 4 on page 33, we have a range of different oral health promotion services available. They range from training early years professionals themselves in understanding the importance of good oral health and what that means and how they can train families and children that they work with, right through to running oral health promotion training sessions in some of our more community-based settings, such as faith centres, libraries, community centres, etc. There are a number of partners over the course of the pandemic that have been offering out supervised toothbrushing kits or Brush for Life kits, and that has often been accompanied by supervised toothbrushing sessions. And the number of kits that have been distributed to children and families over the last year have increased and have been more than what we would previously provide. And that has a lot to do with, again, the reduction in clinical services and the need to still be able to support our families through other means. One of the things that we have recognised through this oral health partnership group is that we have a lot of health promotion training sessions targeted at early years providers and professionals themselves, but that we probably need to increase the number of health promotion sessions that are available to children and families. So we are currently looking at ways in which we can do that. And one of the ideas that we had that we're going to be moving ahead with is to expand the number of sites where health promotion sessions are available to families. And some examples are sites via the Social Welfare Alliance, such as our food clubs, as well as some of the baby feeding classes that are run by other service areas within the council. Another area that the partnership group has agreed to move forward on is doing some targeted health promotion sessions within some of the areas of the borough that have particularly high rates of oral health concerns and tooth decay, and that includes Canning Town North, Canning Town South and West Ham. So it's an ongoing process, but I think what we've seen through this partnership group is that we do have an even spread of services across the borough, but our next steps are to expand the number of sites where these services are available and to do some particularly targeted work in some of the areas of our borough where we have high rates of tooth decay. Thanks, John.
Thank you. And just to indicate that Jeremy Wallman from NHS England has now joined the meeting for this item. So I'm sure there'll be questions that Jeremy will help us answer. But back to you, Chair.
Thanks, John. Thank you very much, Ashley, and welcome, Jeremy, as well. Any virtual hands in the room?
Chair, Dr. Rima Bain put in the chat she would like to speak on this.
Yeah, hi, Rima.
Hi, thank you, Chair, and thank you, John and Ashley, for presenting that. My apologies, I can't raise my hand virtually, but I'm very glad that this has actually come to the board today. And one of the issues I had before was actually around access. So it's good to see that the emergency appointment seems to be higher than the London average. But what I'm hearing on the ground and what we have been seeing in general practice is higher number of people asking for, let's say, kind of, antibiotics for dental issues that needed to be addressed as an emergency. And it seems to be an issue with access to that, whether they're going through NHS 111 or they're coming via us. So it'd be interesting and helpful to know in a bit more detail what those NHS versus private appointments are, the access, etc. Because I think there needs to be a bit more communication out to the public of how they can access it. Thank you.
Thanks, Rima. John, did you, and Ashley, did you want to? Jeremy?
Yeah, I mean, I think there's a general, there's quite obviously a lot of detail there. And obviously we are, we've moved along a little bit in terms of, the reopening up of dentistry generally as a result of the pandemic. I think around things like prescriptions and access to urgent care, there's a pretty comprehensive level of availability to that. I think I'm not going to get into the whether. I think basically in some cases prescriptions clearly will be issued. In most cases where we are in London, if people need urgent access to urgent dental care, then it is through 111. But then obviously that goes straight through to the commissioned dental nurse triage service that we have in London. And in some cases that it will be a case of, depending on what people are reporting, that it is a prescription, and we do have prescription hubs set up in London for that reason, because there are an awful lot of scenarios. I think probably the worst bit about it is that obviously the incidence, if you like, of people ringing up in that position is increasing, because this is just the place we're in at the moment, unfortunately. So access to urgent care is not an issue. Certainly because of the services that we've got commissioned, and we've maintained a 24/7 delivery, both in terms of triage and our face-to-face urgent dental care. That spans from basically 8 a.m. across London through to 1 a.m. Not every site does that, but we do have that level of delivery. And that's where we're at the moment. The majority of care is centred around urgent care, and those in pain, because obviously access to that via normal, what you would term high street dentistry, is limited, because they are basically at capacity, and their ability to deliver over and above the 65%, which is what they're contracted to deliver now, in terms of their contract, is very, very constrained. And obviously the pressure in terms of dentistry is high in Newham anyway. It was before the pandemic, and I think what the pandemic has done is just simply compounded an issue that was there beforehand. So it's not something that's lost on us, but it is a challenge at the moment.
Thank you, Jeremy. So for me, it's just picking up on what you said. There's something about bringing some of this together, because 111 is not something that we're well aware of it, but that we commission locally and communicate. So there's something about comms. So we'll carry the discussion on.
Yeah.
Thank you, Wax. Well, I really welcome the fact that somebody's actually here from NHS England, because this has been on our agenda pre-pandemic. I think from the first time I sat on this board, which was probably January 2019, we have had ongoing discussions about dentistry in Newham. So I'm really glad that we're back here again. I think this is probably the third time we've had a report on our agenda. I have 2, possibly 3 issues. One is there is now no provision at the Appleby Centre for children and young people or adults with a learning disability or a disability, and that is having a real significant effect. We have no idea why it's not being provided. We get no answers. The other issue is that it's having a real knock-on effect for our care leavers. It was raised during the monitoring visit when we had Ofsted in last month or the month before, where they were looking at children in care and leaving care. And that was one of the things that was raised, is non-access for our young people. And third, what I find really frustrating is that anecdotally, obviously, people are waiting months and months and months for an appointment, and yet if they were willing to pay, they could see the dentist that day in the same practice. And I think that is quite immoral, especially in a borough like Newham. And I understand the 65%, but if you are really in need and you try and get an appointment, it's almost non-existent, or you wait months and months and months. But actually, if you were to say, oh, I'll pay for it, then actually you can get an appointment that same day. So something needs to be sorted out. Thank you, Chair.
Jeremy, did you?
Yeah, sure. So around the learning disability side of things, I'd like a bit more detail on it. I mean, obviously, in terms of commission services, that's normally delivered via our community dental service, which in the area that you're in is delivered by the Kent Community NHS Trust. So I'd just like to understand a little bit about that, because that's not something that I have been made aware of until this moment in time. So if you can send me a little bit more detail on that, I'd just like to understand what was there and what you think should be there, because if it's a reduction in service or for whatever reason that's occurred, then I'm more than happy to investigate that. As I said, that was news to me. I think in terms
that, Jeremy, that is the location of the community dental service.
Yes.
Yeah.
So that's what I just need to understand, because if there is a service reason why that's occurred or why there's been a reduction, it's not. This is the first time it's been brought to my attention. So I apologise if that is the case, and we will certainly look into why that is occurring. If there was certainly something there before. As I said, it's the first time I've been made aware of it. So we will. I will take that away. And we'll make a point of actually investigating that and just understanding what's going on there. I think overall, in terms of, as I said before, I think there is around the access is difficult. There's no question. I'm not going to soft soap it. Access to routine care is a challenge everywhere, right across London. You do have some differentials, and it's not necessarily there, but it's generally a consistent issue. So primary care as a whole will see whatever they can see. I think the issue around the private, and I'm not going to, again, a lot of it's anecdotal. What you generally find is most of the nailed on NHS practices are full. So what they will do in some cases, if somebody wants a routine appointment or it's maybe not urgent, a lot of practices will say, we will see you privately, but it'll either be outside of normal working hours. So it may be evenings or it may be weekends. And they're at liberty to offer that. More often than not, the practices themselves, in a lot of cases, it won't be a case of squeezing a private one in and amongst the NHS, because in most cases they're full anyway, and they've got full appointment books. So it does occur. And the whole issue around offering private appointments has been around, ever since I can remember, and it does occur. But at the end of the day, they have an NHS contract to deliver. And even though they are working at a reduced contract capacity, they still have to deliver on that contract. So in a way, if they've got availability from an NHS point of view, they will fill it. But I think the issue at the moment is their capacity is completely and utterly constrained. So where patients really want to see, then inevitably they will. Sometimes we will see you, but it may well be outside of when they would otherwise be seeing our NHS patients, in which cases it may well be private.
Thanks, Jeremy. Councillor, there was a third point as well? There was
no point. No further question.
Okay. Thanks, Jeremy.
Did you? Okay. Just thank you, Jeremy. I guess what I want to just pick up on is something that's already been said, but just in more detail in relation to children, young people, young adults that have special education needs and disabilities, and that dentistry.
Yeah.
And one of the things I read in this paper is in regards to the work that's going to take place post-COVID in relation to recovery.
Yeah.
And it's talked about reducing the inequality. However, I just want to understand amongst that community, the SEND community, the inequality that they're affected by, especially if there is no service. And I think what we haven't taken consideration is that those young people that would normally fall in the category of a specialist service run by community partners don't sit anywhere when that that specialist service is not here. But second to that, dentists are not taking on any new patients. I just worry. My concerns are the impact of that inequality amongst our most vulnerable residents, and the unintended consequences of that in months and years to come on those, especially young people.
Absolutely. I mean, from our point of view, so I suppose, small steps a little bit at the moment, but if I give you an example, so, there are a number of what I would call vulnerable groups that are suffering as a result of the position we're in at the moment. So we've just gone down the line of actually setting up a bespoke service effectively for looked after children. And this is right across London, because again, they are a group of people that, are vulnerable by their very situation. And this situation where normally these children would be booked into a local dental practice for a checkup. And it's just not happening. So what we've done is we have via our urgent dental care hubs, and we've got 40 of those across London. The service actually started on Monday, and there is a fast track in for those patients to be seen, because obviously, as we know, that a lot of them will have come from very difficult circumstances, and actually this is just one more, but this is one more thing that they have to go through. So we don't want, young people and young vulnerable adults or young people being delayed for what is basically a routine dental checkup, because obviously in some cases there may well be nothing there, but if there are things there, they need to be picked up and dealt with before they are settled anywhere. So we've started there. Certainly in terms of the patients that you referred to, my take on it is what we need to do is understand if there is a deficit in terms of, and we know there is in primary care, but we obviously commission community dental services, which effectively pick up paediatrics and special care. And within that, very clearly, there is a whole list of groups of patients that are eligible to be treated by that service. Now, obviously, they're like any other service, they are recovering to a certain extent, and there is a level of a backlog, but those patients are more than eligible to be referred into that service to be seen. Now, if there are problems just in terms of capacity and volume, then we can deal with that. But what I would say is there are services in place for those patients to be referred into and seen. If there are experiences there where patients are finding it hard to access them, then I need to know about it, because those services are contracted to deliver to that group of patients.
Thank you. Chair, is it okay to have one more? Just in regards to, and I apologise, I don't want to sound overzealous.
No, it's fine. I quite understand. Don't worry.
But I do want to just go back to that point that you said, and I wrote it down in the statement you made, which was urgent dental care is not an issue.
It's not. It's communication of it may be an issue. What I probably need to make it clear, the access to urgent dental care in London is available in terms of triage, certainly 24/7. It is because what happens in London, which is unique compared to any other region in the country, is when a patient rings 111, it's dental, it is straight through to the dental nurse triage service. They will then triage that patient, and if they need to be seen, they will be referred to an urgent dental care centre. Now, obviously, some of that, hopefully, that's somewhere that's close by. If it's depending on what time of day it is, it may well be that there's a need to travel any further. But certainly our fervent belief is that anyone in acute pain should not have to not be able to access dentistry. So in addition to our triage service, we still have fully functioning 40 urgent dental care centres, of which we have a number in Newham. And we also have a considerable number in North East London as well. And we've maintained that delivery at considerable cost, because obviously, you know, to a lot of people, the pandemic's over. But if I tell you that the triage service is still receiving between 12 and 1,500 calls per day from patients wanting to access dental services. So we have to have something in place, and we do have it. Now, obviously, there may well be occasions where people are kept waiting a bit longer than they need to, but it is not excessive in London at all.
Thank you, Jeremy. I'm going to use my own experience in regards to dental care, because I'm fortunately one of those patients that have actually contacted 111 for an emergency appointment, was sent to a dentist who saw me, but wasn't able to do the work that's needed because it meant I needed an extraction.
Right.
But I have still been waiting. I think we're now into the 13th month for an extraction. So I think I hear what you're saying, and I don't disagree, or I'm not trying to accuse of anything, but I just would like to maybe to understand actually on the ground here in Newham, is it actually what it is that you're saying? And I've heard the challenge from you, which is if it's not what you're saying, then you need to know about it. So I guess I'm taking that opportunity to say it's not happening, Jeremy. And actually on the ground, that urgent care piece may not be working as well as you may have hoped it to be working here in Newham.
No, that's fair enough. And I mean, obviously it's difficult to comment on, you know, a specific scenario. I'm not clinical. So in most cases, the raison d'etre, if you like, of the urgent dental care service is to get people out of pain. Now, obviously, there are a number of ways where that may happen. And in terms of an extraction, I'm not a dentist. So, you know, if there are reasons why an extraction is not taking place, because obviously in some cases they can be more complex than others. I can't, you know, it's hard. But if there are specific scenarios in that case where you think, well, actually, I haven't received the service that I think I should have done, then again, I need to know about it, because we have had scenarios where people have sort of raised concerns about, and we've followed them through.
Yeah.
And more than happy to do that. And if it turns out that you haven't received the service you should have done, then we'll make sure that you do. Because certainly from my point of view, we've set a lot of store by the fact that we do have a good level of urgent dental care delivery in London. We have to have, and we continue to have. And my fervent belief is that even when things get back to even some semblance of normal, we will require it, because unfortunately there are an awful lot of people in London particularly that don't go to the dentist regularly. And some of that's not even if the access available, people choose not to access it. And there are all sorts of reasons for that. That's not criticising people, because some of it is purely down to pure economics, because even NHS dentistry has a cost attached to it. Yeah. For some people, that's too much. So people will access care when they only absolutely need to access it. Whereas before we didn't really have any real urgent care delivery in the daytime, where we do now, I think it's here to stay. And as a London commissioner, we will continue to deliver it, because it's required. And particularly while we have poor access to primary care for routine care, if we took it away, I think we would have a huge problem. So we will be maintaining it, but obviously at the same time as trying to recover primary care to a level where people can be seen for routine appointments.
Thank you.
Thanks, Jeremy. I'm just thinking, listening to this, whether there is a formal channel or a communication between the commissioners and and how we build that. Can I go to some virtual hands first? Is that okay? Mayor Fires.
Thank you very much, and I very much appreciate the officer's presentation of the report. I guess listening to Jeremy and sort of the new position, which has been long-standing as it pertains to oral health, and we've always been below average. I want to ask the question whether the NHS roadmap to recovery as it pertains to oral health is sufficient and adequate given the long-standing features of low oral health addressing in Newham, which has been exacerbated because of the impact of COVID-19 on the oral health system, and what are you going to do about it? Because frankly put, even in the context of a roadmap to recovery, with normalisation achieved by 2024, it's not even going to really dent the scale of oral health, the oral health crisis that exists in our borough across all age cohorts. And as much as the preventative service is valued and is valuable, it can only do so much. And I fear that we are witnessing a car crash in slow motion and a oral health crisis of pandemic proportions. And I'm not being hyperbolic, I'm being absolutely deadly serious. And I think it's an absolute travesty that this has been allowed to happen, and that there needs to be some serious rethinking as it pertains to the roadmap to recovery that's been articulated for the London region or nationally. There needs to be a dedicated focus on Newham and similar places like Newham, because otherwise it's another demonstration of the institutional and institutionalized acceptance of racial inequality and low-income household inequality that exists within the entirety of the health service. So can I get some assurance, based on what you've heard, what are you going to do about it? Can we have a bespoke recovery emergency response? Because you are leaving our residents bereft of access to a really, really vital health service provision, and it's not acceptable. And I appreciate there will be capacity constraints in terms of the system, et cetera, but this really does need to be addressed. I'd like to understand what you can do in terms of a recalibrated Newham specific roadmap to recovery, which doesn't take us to 2024.
So I'll be really honest with you. We cover, and my responsibility extends to the whole of London. So in terms of bespoke, I'm not going to make that commitment because I can't. We have to look at the position as a whole. Now, part of where we will be going, though, is obviously over the next year or so, there's going to be closer integration in terms of the ICS, which will be covering, you have an ICS for North East London, and there will be closer working with them at a local primary care level, because obviously, where we're at the moment, we're working from a London perspective. The position is the same wherever you are in London, and it doesn't underplay that obviously some boroughs are far worse than others. And in terms of where we are, to a certain extent, we can only work with the resources we have available to us, and I think everyone knows that. We are in a position where the resources we have are the ones that are already invested in general dental practice. The wider issue here, really, to be perfectly honest, is the primary care contract that dentistry currently works under. It doesn't work particularly well for patients. It doesn't work particularly well for the contractors who are operating it. And that is out of our control. That requires contract reform at the highest level beyond us. Now, if someone was to come to me tomorrow and say, we're ripping up this one and we're starting again, I'd be over the moon, because actually what it would allow us to do is to get into some of the things you're talking about and actually target a bit better in terms of where some of the resources should be concentrated. We have dental contracts all over London, and there's money tied up in all of those. And it's not simply a case of moving it from one to another, because at the end of the day, dental practices are required everywhere. And we're not in a position to it's not a case of just move that. And also, I'll be really honest, there is no extra money. The money that's invested in dentistry is invested in dentistry, and that's what it is at the moment. We are working in a scenario where general dental practices have to achieve 65% of their target in order to keep 100% of the money. So if they do that, there is no additional resource. Where we are in a position is if they underperform, we do have an opportunity to reinvest some of that money. But at the moment, that's not happening. So in terms of a commitment as far as Newham's concerned specifically, I can't give you that. It's not in my gift to do that. In terms of specifics, in terms of Newham, we've been here before. The issue in terms of access is, and I'll be really honest about this, if we commission 5 new dental practices tomorrow, I can guarantee you the problem would not go away, because those practices would fill up just like that, and access would still be a problem. So there's a wider issue, and it's incumbent on all the agencies involved. It's not just down to us, because commissioning more dentistry is actually only part of the answer.
So mad it is.
So that's the position we're in. We don't in any way underplay it, and we have to have the roadmap is an honest view. If we get there before 2024, I'll be over the moon with that. But we have to be realistic about where we are at the moment.
Jeremy, I'm going to allow me if I to come back.
Sorry, if I may, the roadmap isn't an honest roadmap because it's lying and it's giving a bad deal to local residents, not just here in Newham, but also across London. And, the lack of honesty around the roadmap needs to be illuminated on. And if you don't have the power and the gift to be able to start enabling us to work with you to challenge the position, because it is unacceptable, then we need to, as a board, pull together the right people around the table and start having those serious high-level conversations, because frankly, there's no point in any of us sitting on this board if we're not going to be doing the disruptive challenge piece across all areas of health inequality, including oral health, and just think that this is acceptable, because it really isn't. I mean, it's going to lead to a whole series of other health issues further down the line, and we will be dealing for generations to come with a population with really, really bad oral health and everything that entails. So, I've noted the recommendations in the report. Recommendation number 3, requesting a detailed plan considering geographical access and inequalities from NHS England to blah, blah, blah. We've more or less heard from Jeremy, who's responsible for the London region. He can't give that commitment. So who is it from NHS England who's got the power to be able to make that commitment and for us to demand that detailed plan is enabled, it's developed, and it's resourced, because this is just unacceptable. Thank you.
That's fine. I don't have, you can, I would take exception to dishonest though. We've been very honest in there. I don't make a habit of making dishonest statements. I've been very frank and honest with you. I don't dispute the issues, far from it. But from a point of view of the resource and all the rest of it, you're more than welcome to make representations to NHS England. I have no issue with that whatsoever. But I would take exception to the detail in there being referred to as dishonest, because it's far from.
If I may, just to clarify, I actually said the roadmap to recovery is a dishonest roadmap.
It's not.
Because it is not enabling us.
It doesn't make it dishonest.
Sorry, can you stop interrupting me, Jeremy?
Well, I really take exception to a report being referred to as dishonest. And Jeremy, that's come from us in good faith.
You've made your point, okay, and I'm just speaking by the chair, so please stop interrupting me. Chair, just to clarify, I said the roadmap to recovery is dishonest. We've heard a view from colleague from NHS England with regards to his view, but it is dishonest in the context of a roadmap to recovery as it pertains to oral health, when there has been a inefficient and ineffective roadmap around oral health resourced adequately, both in terms of money, but also the capacity in the system here in Newham for a long period of time, exacerbated by COVID-19, and we're facing a ticking oral health time bomb. Thank you.
Yeah, thank you, Mayor Fires. And can I just remind everybody to go through the chair when they wish to speak. Mayor Fires, can I bring this item to a close, and then also can we agree an action on how we're going to take this?
I think there was another hand up, Chair.
I had raised my hand up before.
Okay, Councillor Ali.
Thank you, Chair. And I think Mayor has said what needed to be said. But to be honest, Jeremy, you know that we have the lowest, the borough, the accessibility is a serious issue. You've heard that. The report clearly says that. Health Watch has done a great amount of work which actually highlights those issues. And you've seen also that emergency treatment has gone up. So, I mean, as a commissioner, and I'd like to know what is your role, not you specifically, but NHS England, how do they monitor the performance of these dentists? You've heard my colleagues raising the issue about private NHS appointment system. Is there any mystery shopping? I mean, you said the 65% is the target to achieve to get 100% payment. How many of them are achieving 65%? Where is the data? Let me finish, please, first. The UDAs is a measure of the amount of work they do. How are the UDAs distributed among in terms of simple filling or dentures, etc.? And how does that help you to define what oral health priorities are? What should we focus on in terms of long run? To put forward, a recovery plan, frankly speaking, I mean, the entire language that you've used is very theoretical. It does not resemble what the situation on the ground is. I suggest you read the Health Watch report that Julie's team has done. It will highlight a number of issues. But the disappointing thing is that this is simply coming back as a central government bureaucratic wording and terminology, which is putting us off, frankly. But we have to deal with people on a daily basis. The practical experience of people utilizing dental services is absolutely poor. And I think you may not be the right person to answer this question, but I think you should take this back to whoever is responsible for commissioning to tell us, perhaps come back, within a few weeks to say exactly what is being done. Yes, recovery plan is there, but what are the quick wins? The issues that have been raised in this report. The UDA distribution, as I mentioned earlier, the preventative work, how much pressure we're adding onto primary care. And I don't even know what the data is for when people go to hospital. Are we using that intelligence in order to design a better service? Or are we simply titling ourselves as commissioners and simply get on with it and say, if you achieve 65%, that's a tick box, you get 100%. That is not the best use of public money. Ultimately, we as ratepayers pay for the service and we deserve answers. And frankly, with due respect, you have not been able to answer. Now, you've been in a very defensive position, and that is unacceptable from this health and being perspective. And we would like you to take it back to whoever is responsible to get some answer for us. Thank you.
Jeremy?
As I said, I think from a point of view, I think it goes back to a basic understanding of NHS England's role is to commission NHS dentistry within the contract that GDPs have. And that's what we do. They are commissioned to deliver against a set UDA target, which is what they're set in terms of the contract that they have. And we are responsible ultimately for commissioning and paying for that activity. Wider than that, and we talk about oral health, and if we talk about oral health promotion, there's an aspect of that we're not responsible for. We work with the local authorities on that because ultimately the budget for that, pitiful that it is, and I would completely agree with that, is insufficient from a preventative point of view. This is, I think, probably 6th or 7th Health Watch report I've had from different boroughs saying pretty much the same thing. And as I said, there is a clear acknowledgement there that there is a problem. And we are just working our way through it, but we have to do it within the parameters that we have to work within. I'm not going to come here and make promises that I can't keep. I completely hear you, and we will go away and have a look at the position we're in, but there's no quick fix here. And this is going to take some time to sort out. And as I said, this is compounded, the pandemic completely, and I completely agree with what the Mayor said. A lot of what she said, I completely agree with. We are sitting on a ticking time bomb, certainly in terms of oral health, because that lack of access to it for a long, long period of time has a massive impact on people's wider health. Completely accept that. But I think some of the frustrations that I can clearly hear are well, I can completely concur with them, but they're not something that I actually can, in many ways, can solve, because actually they're systemic, and a lot of them sit at a much higher pay grade than me and beyond the London region, because ultimately dentistry is commissioned as a national contract, and we as commissioners oversee that. The fundamental issue sits with the GDP contract as it currently sits, not fit for purpose. It certainly doesn't serve patients very well. And it's made it far, far worse. The position we're in at the moment has just been compounded. And particularly for areas like Newham, where access is an issue, and all of the inequalities that exist there, it is worse. And we do have other boroughs not dissimilar. But as I said, we have a London-wide remit to try and work through here. So it's not a case of, we can't be in a position where we're favouring one over another, but there are exceptions to that.
I'm conscious of time, everybody. So, Mayor Fyers, I wanted to bring this to some action, really, and how we're going to take this forward. We're clearly at a point where we've talked about the adequacy of the recovery that's been presented. We clearly recognise that action is needed in multiple areas. How do we move forward with this? We've heard that, you know, commissioning sort of movement towards the ICS kind of situation, for me, that's too far down the line at the moment, and action is needed tomorrow, if not yesterday. So I'm just thinking, scratching my head, Mayor Fyers, for some actions around how we take this forward and next steps.
So, I mean, if you look at the recommendations, and thank you, Wax, recommendation one that we're asked to consider, no, approve, whatever it is that we're being asked to do under the recommendation, outside of considering, because there's one thing to consider, but what's the point of considering if we can't actually change things? So approval of the approach to increase health promotion sessions for children, etc., the other cohorts, the expansion of all health promotion services into resident groups, etc. I think I just have a problem with 3 based on what we've heard today, and actually maybe that needs to be amended so that it's you know, I mean, it just feels as if it's going to fall on deaf ears. So what's the point of speaking to the service at a regional level if we need to go national, and if it's the government minister, then so be it. But what can we also be doing within the sub-regional health patch? You know, there was a comment made around the integrated care system and how that may help remedy some of the issues.
It's too far down the line.
And I've also noted that there's this all health sort of task force. They're going to be pretty much constrained with regards to some of the structural impediments that we've heard about. And I'm quite curious with the use of the word, you know, exceptional circumstances, if I heard it correctly. There are some exceptional circumstances which make me believe there could be the possibility of exceptional interventions, notwithstanding this is a similar picture across all of London, but this has been a long-standing picture here in Newham, exacerbated acutely by COVID-19.
Okay. Jason, did you?
I think we need to amend that recommendation.
I'm just going to suggest, in terms of, because I think we have kind of reached a point in this discussion, but I'm happy to take away alongside Ashley and my team, and thanks to the work you've done, and John, and in linking in with Jeremy to think about the right way to make those representations that we need to make around the recovery plan, around how within oral health, you know, the NHS's commitment to tackling inequalities is recognised within, you know, as it's being recognised in lots of other areas of the NHS, how how that recognition is being realised in terms of oral health. So I think clearly there's a bit more discussion that maybe we can have with Jeremy outside of this, and then think about what kind of representation we want to be making, kind of up the chain. I also think, you know, I'm going to go back to the team along with Jeremy as well, and just think about what more we could be doing in that prevention space, because I do, you know, whilst I think we need to absolutely make the case for that primary care dentistry, and remembering that primary care dentistry is prevention. It's really, you know, that's what it is. But the kind of more upstream prevention and what more we can do, like conscious, you know, things like fluoride varnish in schools probably isn't going to come back for some time. I don't know, Jeremy, nod or shake your head.
Yeah, I mean, I think in fairness, and I think you've hit the nail on the head around the prevention. In effect, yes, primary care is the first port of call for anyone in terms of dentistry. But I go back to, there is absolutely no specific reference to it in the contract of the GDP's hold. You know, it is sectioned around 3 bands of treatment, and therein lies, you know, part of the problem, because there's effectively no real incentive for it. So, as I said, contract reform is sorely needed if we're going to address that from a prevention point of view, because it needs to be factored in. It needs to be part of what they do, and it needs to be in black and white. But I think around fluoride varnish and that type of thing, you're absolutely right. So it's opportunistic, particularly where you've got children coming into a dental surgery to receive fluoride varnish. And obviously, it's not just the sole preserve of the community dental service. It is something that should be provided as a matter of course. It's well evidenced, and there's plenty of public health data that supports it. But it's a small part of a bigger picture.
We're not going to be able to solve this today. We need
take it as an action and we'll communicate in the intervening period about what we won't leave it till the next board before we've made that representation.
No, absolutely, and I think we need to just outside the meeting think about the support that we can leverage from the developing ICS as well, because that's going to be part of it going forward.
That's what I was thinking as well, Chair. Yeah.
Okay.
Chair, just to finalise the action, I think there's some information shared about specific cases and concerns that we need to make sure are followed up as well. So we need to have that as an action to collate and share those with NHS England and other providers who are relevant to make sure that those are resolved.
Yeah.
I've made a note. So brilliant. Thank you very much. Thank you, Jeremy. I mean, we could go on talking all night talking about this, but we're not going to move until we start to make that representation clearly. So thank you very much, Jeremy. Thank you for joining us. And,
you're welcome.
And can I just remind, can we go through the chair when we're commenting and asking questions? Thank you. Item 5, children's mental health. Future in Mind is back. Who's taking this item?
Hi, Chair. I guess it will be myself, and then John and Maria here as well if they need to chip in with anything. So I'll try and get us back on time as much as I can. This is just, just as kind of sign-off approval, commitment from partners to enact some of the commitments and the plans, agree with it as well. I really just appreciate and understand and note what's happened over the last years, what we've done and where we're going. So I'll quickly run through what it is. So the CAMS Local Transformation Plan, it's essentially an annual plan that each local area develops, which outlines and describes what the local area is doing in terms of children's mental health. In particular, how we're going to meet the ambitions of the NHS long-term plan and some of the other local strategies and really just improve access and outcomes for children and young people with mental health. I should note that this plan, so the 2021-22 refresh covers 2 years. Last year, obviously, because of COVID, they delayed the plan. So this one covers 2 years worth of development, transformation, etc. So I'll quickly run through some of the highlights of what's happened over the last few years. I think some of the main ones have been, our continued, commitment to invest and expand and improve some of our children's mental health services. So some of the key ones, such as the eating disorder services, our crisis service, which has gone from a few hours a day to now a fully staffed 24-hour service, 7 days a week, crisis service for children and young people's mental health. Winning a bid to develop mental health support teams, to really expand and develop some of the learning and some of the work that the Head Start team and organisation have done with regards to mental health in education. So they're developing new mental health practitioners that will go into schools and provide access and mental health support for our children in schools. So that's a really great piece of work that it's just up and running and will continue to expand and increase in capacity over the next few years. Some of the other key areas we've taken some of our online digital services, such as Truth, which is an online platform. Young people can receive counselling and advice and peer work in regards to how they're feeling in their mental health and well-being. So that what was a 11 to 16 service, primarily aimed at or received by children in schools. We've now developed that and committed to, or rather extended the commissioning of it really for the next 3 years, and then broadened the scope from 11 to 18. So, we can expand into some of those colleges as well. And so really some of the children that we'd see 15, 16 can still access the service that they've grown to know and really benefit from. So I think some of those key highlights of work as usual, business as usual, new transformation and development that we've done. Obviously, COVID was a thing and still is a thing, and unfortunately, we still feel that impact. So with increased waiting lists and waiting times due to some of the service impacts of pausing, reduced capacities, school closures, etc. And obviously with that and all the other detrimental results that COVID has had, the young people that CAM services now see, they've noted that the complexity of those cases has increased. Children now require more contacts, more appointments, more hours than they would usually or would previously, I should say. It wouldn't be remiss of me to say that the bed capacity has also been an issue, as I've said, both tier 4 and in acute, all seeing reduced capacity, meaning less people can be admitted and receive that inpatient support. And that also has further bed pressures in the acute settings of people, essentially waiting in line, so to speak. So those are some of the things that did happen. In regards to the response to some of those things, I think you've probably heard, hopefully, about one of them, one of the big shining best practice lights that we have in UM is that there's a multi-agency collaborative that I think we're developing into the single point or single front door. So that's a partnership approach, partnership agency from health, CAMS, education, Head Start, lots and lots of voluntary sector organisations, social care, essentially getting together to identify some children who may not necessarily need CAMS intervention, and the support could be provided alternative provisions in the community, such as through the voluntary sector. So that has had great success. You know, hundreds of children have been seen, and is being developed into that single front door, taking the learning forward and widening the scope and breadth and capacity of that. Obviously, with funding, I should say that it's continuing to come through. Obviously, we have our investment standards that we're meeting and continue to meet, and with some of the additional investments from spending review and winter planning. We just received the winter planning for this year as well. We're continuing to develop and understand where some of the pressures may be in light of, you know, usual winter, but also how COVID has changed the situation and how the population access services. And that funding is being used to really bolster some of our services and really think about new ways of working and new things that can be done to really avoid some of those pressures that I previously alluded to. In terms of the future plans, obviously the plan, the document has a list of all the actions and plans that we're doing. I've mentioned some of the already, you know, continuing and expanding the mental health support teams, developing the MAC to a fully functioning single front door, linking lots of different areas, your time, social prescribing, to get a good holistic offer and hopefully quicker access for identified needs for young people, and then further expanding the crisis service and hopefully looking into a home treatment team offer that we can embed. So yeah, so I think those are, that's a brief outline of the plan, what's happened, what we've done, and some of the plans for the future. And as I said, we're here just as a final showing of what's happened, hoping that partners around the table can agree with it, are happy with the plan and what's happened, and can really agree to take it forward. I should say that obviously it's a big plan, and this is only the Newham plan. Obviously, we're now part of a wider North East London system, and all the other plans can be viewed. They're publicly available on the North East London CCG website. So there's an executive summary across all 7 boroughs, and all 7 borough plans are there as well. So yeah, I guess, I don't know if John or Marie wanted to chip in, but otherwise happy to take some questions.
Thanks, Matt. I think we've moved to questions. Thanks.
Rima?
Thank you, Chair, and thank you, Matthew, for sort of presenting that. This is actually just more for note, and we've obviously had extensive discussions at the Newham Exec and Partnership level. And I just want to say that we all recognise the amount of effort that's actually gone into this, from where CAMS was and the position and the demand, and the pandemic has been, you know, really young people have been really affected. We've seen it very much in primary care. I actually just want to thank everyone who's put so much effort into developing this plan. And all I do hope is that it is sustainable going forward, because there's a massive amount involved. And yeah, so it's just more for recognition, and we're in it. I think, you know, seeing those figures now, we're in a better position. And as I said before, I just hope that we can sustain that, because I do feel that this pandemic's not going anywhere, and we will still continue to see that high demand in the young, especially in the young, you know, population, mental health. Thank you.
Thanks, Rima. Paul.
Thank you ever so much. I suppose just to add to what Rima said, I think the couple of things, if you don't mind, I just wanted to pick out that Matthew didn't mention. One was the emphasis in this plan going forward on people who are 18 to 25, and really coming to work together in a way mirroring a lot of the work that's been done together, but to really come to work together on some of the issues about transition, as we've traditionally called it. And just to really emphasise that, because I think there's a foundation to build on in how we take forward work for young people in that area. And secondly, just to mention, or more than mention really, the importance of young people's contribution in co-producing what's in this plan, steering what's in this plan, and increasingly in the way we're working with us on what good quality looks like, judging that, helping us with service provision. I mean, the contribution of young people, of the adolescents on the inpatient units, for example, has done an awful lot to really improve experience, length of stay, and admission numbers and so on, even in the short amount of time they've been doing that work with us. So I did just want to pull that element of this work out as well, because it's been incredibly powerful.
Very much, Paul. Paul, I just wanted to just ask a quick follow-up. So in terms of pound for pound spend, so we've said that we're moving to this, the North East London kind of situation. Chronic kind of funding issues, resource issues, and we were in the situation we have, and this plan is supporting a decent recovery for us to move to a much more positive picture. Where do we kind of sit in terms of equity, in terms of funding and resource, pound for pound in Newham? And actually, is it enough? And does the Health and Wellbeing Board, the team here, need to support the challenge we face in equity? Is there a challenge in equity that we need to take forward? Because when we move to things like mental health collaborative across North East London, we don't want those gaps to widen, do we?
Right. So, I mean, I can certainly give you my sense of that. Which is that Newham obviously has a very young population. And so we do need to make sure we are continuing to see resources come to meet the needs of the population. I would also say that one of the things this plan, I think, really is helping us to do is to think about resources in Newham and how we can work together using the Newham pound to its best advantage, which I think in turn then helps us really understand how we sit in terms of equity with other areas. I would also say, obviously, we have our mental health investment standard money this year. We have more money coming next year. And we are certainly working across all the boroughs in terms of how that money flows in relation to size of population and need in the population as well. And then I certainly think there's an element there in terms of your question about this Health and Wellbeing Board and how making sure that the MIS money the Mental Health Investment Standard money continues to flow into the areas it's allocated and has been used in that way. You will see that the national targets for CAMS do not aim yet to make sure that 100% of all children and young people who need to be seen are seen. So there remains a very important set of priorities about how we step to the point where all the young children and young people we think need to be seen are getting seen at whatever level, whether that's at school or at home or in kind of formal CAMS services. That's not a Newham specific comment, but it is clearly one that I would say this Health and Wellbeing needs to stay focused on. And finally, I think another area for this Health and Wellbeing Board will be, as we see the impact of some of these community changes and community developments, we are already actually seeing a change in the pattern of young people being admitted to hospital. We are actually seeing fewer people come through to hospital. We're seeing them spend less time in hospital. We're seeing them spend more time with families, more time at school. That in turn, of course, releases Newham resource back to spend in Newham and spend in the community and spend on this plan. And I certainly, to finish, think that's a really important area for this Health and Wellbeing Board going forward, because it's a real example actually of how this work across agencies, work with the young people is already starting to help us shift and bring some of that resource into community alternatives.
Thanks, Paul, for bringing that to life. Tim?
Thank you, Chair. Just wanted to make a few comments, Chair. Thank you for the report, and I think it does represent an awful lot of of good work that's gone on recently, and some really ambitious plans moving forwards. As one of the responsible officers for the Growing Well programme as part of the new executive, my role is to oversee some of the developments of the response to children and young people's mental health needs. And I think what's been really encouraging has been the level of collaboration that Paul has referred to across a range of services, and some really innovative responses. And we can see the multi-agency collaborative as one of those in the paper. But I think we are now drawing on more funding coming in from other external sources, and I think there's more scope to build on that innovation, but also to ensure that we're improving access for these services. And I think one of the key challenges, not only in Newham but across London, is thinking about a coherent approach and model of early preventative care in this area, and that's certainly something in my role as lead director of children's services for children's mental health that I'm pushing for. And finally, related to Paul's last point, I think there's been some great work on some of those young people with more complex needs, and some really good work to step young people down from tier 4 provision or to avoid the need for admission. But I think there is a gap in terms of a commissioned service for young people with both social and mental health needs. And I know, again, that's something that's being taken up and addressed through some of the Pan London work. Thank you, Chair.
Thanks, Tim. Colin?
Thank you, Chair. I guess I just want to reiterate, what Tim has just said in regards to this is actually a really well-written document, and so give credit where credit is due. I do have a question that jumps out at me in relation to suicide. So I guess my question would be, what do we know about the early mental health indicators and suicide in relation to this piece of work?
I'm coming to my virtual colleagues.
So,
it's a question I always like asking. I don't like asking it, but I like an action around it.
Yeah, so I think there are lots of work going on in terms of suicide prevention, training, awareness, etc. for all health and social care staff. That does happen. Apologies if it's light in terms in the plan documents itself. But I think it's something that we're aware of. There are numerous steering groups and agencies and partners working together on how do we combat and really improve the situation in terms of suicide and self-harming. I don't know if anyone else wants to jump in.
Geeta?
Thank you. So we do have a suicide prevention board that we've set up across the partnership and in the borough that I chair. And part of the work that board is doing is very much making sure that at every point of access, young people have got those opportunities and those adults to talk to about things that they are concerned about. So it's really making sure that mental health and wellbeing is embedded throughout a whole systemic approach. But what we also know is that often there are triggers, there are indicators, but often we're not seeing them. Professionals aren't necessarily always identifying them and then putting them together in terms of what could be some of those kind of crisis points for young people. And so very much the work the partnership are now doing is to learn from, unfortunately, we've had a serious case review around this, and we're learning from some of the things that have come from that case review and other indicators that young people are telling us about, which is that they just sometimes need to know where to get some advice that's confidential, that often it isn't that the services aren't there, it's really that they need to be there when young people feel that they are in crisis. And so for us, it's making sure that adults and professionals really do understand some of those indicators, are alert to them, and may be able to be more curious about talking to young people at different points in their journey so that we can really prevent that crisis occurring. We will share an action plan from the Suicide Prevention Board towards, I think it will be in January, and I think it would certainly be something that the Health and Wellbeing Board would be interested in having sight of. Thank you.
Thank you, Gita.
Can I just come back?
Yes.
So just in regards to what I've read, this paper that's been given to us, do we need to have something in here that basically says that? I always find that if I'm thinking it, but it's not written, then it can sometimes be missed elsewhere. So I just wondered, do we need to actually have that explicitly in this document? Matthew.
Yes, I don't see absolutely why not. Obviously, it's a big area, it's a big issue. There's those, we should definitely include it. Apologies that it's not there more. That's a gap I missed, I'm afraid. I'm sorry, but yeah. So we'll make the amendments and we will input that and we'll update the public document. Yeah.
Thank you. Please don't be sorry.
I mean, from where Future in Mind started, there was 5 key areas at the time when this is developed, and the new and plan clearly encompasses much wider kind of bandwidth. Councillor Ali.
Thank you, Chair. Firstly, can I say well done to all partners? I think it's an excellent paper that shows that we are working together exceptionally well here. My only observation is that a lot of indicators are quite input-based, that we will achieve this target or that target. But based on the level of investment we have and the initiative that are outlined in this report, I wonder whether we are in a position to actually look at some key outcomes in terms of impact. Like Paul said, that we're already seeing reduction of children going into hospitals. Could we identify some outcomes, say, further down the line, to say, actually, this investment, these initiatives will actually have an impact, where we'll see in 2 years, 3 years, or 5 years down the line, these are the improvements, i.e., there will be less people actually being affected in each of those categories. I don't know whether it's possible to model that somehow.
Chair, can I take that one?
Yes, sure.
So I think, and Paul probably want to add to this, but what we're trying to put in place for all our programs of work, particularly around integration, is take an outcomes-based approach. And within those outcomes, clearly inequalities is one of those. One of those outcomes we are seeking to improve upon. So the reason why some of it is input-based is because that's the planning regime we often find ourselves in from NHS England and others asking us to specifically respond to different lines of inquiry. But there is very much a commitment to co-produce the outcomes most important to children and young people for their mental health and well-being, and for that to be reflected in how our services are governed.
Yeah, no, thanks, John. Thank you. Absolutely need to make it relevant to the needs of our young people. Adam, and then Councillor Chowdhury, and then I'm going to move to the next item, if that's okay.
Thank you, Chair. I just want to say, so repeat the comments. I think it's a really comprehensive report covering a lot of areas, but it's illustrative of the massive agenda there is to address here. I also want to emphasise the point about lots of examples of multi-agency working, which is the only way that these things will be delivered. But want to highlight from a hospital perspective a challenge and some work. So the demand on ED is increasing significantly around mental health presentation. And so whilst anecdotal, one night in the last week, we had 14 people overnight with mental health issues arrive in ED. Some were able to be discharged to an alternative place and some were there in the morning. And one of the things, particularly for children and young people, I'm concerned about is that whilst actually I think the hospital, compared to many, do a very good job in terms of offering a place of safety for people in mental health crisis, I feel we need to be better at starting therapy immediately, not just around the child, the young person, but particularly for the parents, who it's extremely frightening time when their child may have a first episode of mental health, kind of psychotic episode, for example. So we had a workshop recently, again, with partners across the area and also NHS England involved. And again, trying to seek some additional money to work through a pretty innovative arrangement in terms of bringing mental health to the front door of the hospital in a way that traditionally perhaps we've looked to send people away into mental health teams. So I just wanted to highlight, not necessarily it's drawn out in here, but it's at the crisis end of care where I think we'll see some improvements.
Thanks, Adam. Councillor Chowdhury.
Thank you so much. I just wanted to say thank you for the report, and it's reassuring to see the work around awareness and support in a positive manner. But on the other hand, I have also seen parents hiding information even from their GP. And it's not that they don't trust their GP, but some parents are worried that the information will be disclosed to social service and the child can be taken away. All sorts of other stigmas around that. But I'm really glad that in different platforms, it has been addressed recently in a positive way, and then the information is going forward again in a positive way. Often it does not happen, and I hope in the future everyone will continue their good work. But following that, I do know one young person who committed suicide, and then the whole group or his friends were affected. I did not have much information about the support other young people had. Some parents would again withdraw their children from anything available because parents don't understand the positive and negative in a positive manner. So, and a few minutes ago, one of you have mentioned waiting list. I do understand that when the support is even offered, you have to wait for a little while. Now, after waiting and getting the service, I'm sure in all professions, we have some people are more effective than others. Now, if the therapist, him or herself, is not good enough, do you offer any support? Do you identify? How quickly can you identify? I'm sure you do take comments from the parents, carers, the adults. Now, how much support and how quickly you can offer support to the person supporting that young person, bear in mind that this young person is, if not getting the effective advice and guidance, then this person's position can be even worse. I had something else about over 18 as well. Some parents, if they're involved, the situation could be better, but for confidential reasons, parents are not often told, informed, and advised. Again, there are cultural issues and all the other stuff, but professional, I'm sure as professional, you do have enough knowledge and expertise on this field. If it is possible to change, make exams, sort of like flexibility around that, I'll leave it to that. Thank you.
Paul and Matthew, did you want to?
Yeah, certainly. So, I mean, I think there's a lot of, I mean, where to start? There's an awful lot of work we certainly try and do in terms of people's feelings about mental health, and certainly parents' feelings about their children, how their children are feeling, the interaction between their children and other children in different contexts and so on. Certainly, some of the work we're continuing to do, whether it's at school, whether it's in the community, whether it's in kind of clinic settings, continues to be about how we try and reach different communities, work with different cultures, work with different understandings of what might be happening for young people, and to really try and make services as appropriate as they can be. Because I think if I've understood following your points correctly, there can very often obviously be cultural issues as well about understandings and so on. We certainly, when tragic events like suicides happen, we certainly try and put support. We do put support into, very often via the school environment, into try and support the young people's friends and wider networks. And certainly a lot of the work we do within CAMS is very much thinking about the young person and the networks they're in. So that's their family network, their friends networks. In many cases, networks that may have been broken through kind of other adverse events, and how we try and work with that and the young people in particular. And you're quite right to say that sometimes when people pass the age of 18, we do then reach different or some different issues in terms of confidentiality and what people do want shared. Again, we really do try and work with the whole networks around people, try and think about what information we can share, how we can work plans through, and make them really effective. And I suppose rather than take the whole meeting's time, if it would be at all helpful to talk about this kind of outside the meeting in more detail, I'd be really, really happy to, or provide a sort of other briefing, because there's a lot of work we try and do, but there's also an awful lot of work we need to continue to do with people's beliefs about mental health, stigma, and everything that's around for people.
Thanks, Paul. Thank you. No, brilliant, excellent. Thank you, Councillor Chowdhury, and thank you, Paul, and thank you very much, everybody, for the report. Members are sure to have approved, and we've noted the point around suicide as well. Brilliant, excellent. Jason. 6 and 7.
Thanks. I won't speak for long at all. So, as people know very well, in a lull in the pandemic last early November, the 50 steps, and this piece of work just summarises the actions from year one, which personally I feel, given we've had a pandemic going on during that time, is really fantastic. It's the work of huge numbers of people. It's the work of lots of people across the whole of the local authority, lots of people across the whole of the NHS, and many community partners and committed residents. So that's the spirit of our big strategy. It's about catalysing action across the determinants of health. There's a lot to be very proud of. I think the report tries to set out where we see the challenges across the different priorities for the year ahead. It's both a kind of celebration of achievements and a recognition of where we really want to push things going forward. We're going to have a public launch of this alongside our recovery booklet and other things that are going on right now on the 9th of December in the evening. And we use that opportunity, as we always do, to bring people together to talk about those challenges and really engage with how we grapple with the many challenges that we have. So that's it. Happy to hear any comments and or answer any questions.
I mean, during a pandemic when we've all been so stretched, for members and colleagues to continue to push on and try and tackle some of the most wicked of problems that are presented in that strategy is really been great. Councillor Ruiz.
Thank you, Chair. I think it's really interesting that we live and breathe these 50 steps. I mean, it feels as if every time we meet, we talk about 50 steps. But it's really impressive to see it set out like this. And I suppose I really should be looking at priority 10, but actually I should be looking at priority 6. And I had the absolute pleasure to visit a newly created food club last week. And I think many people were quite sceptical about how these food clubs would work, moving from free food banks to actually having to contribute. And actually the women, because it was a women's project, the sense of, I wouldn't say the word pride, but they felt as if they were contributing, and that was really important to them, even as little money that they had. And I just think that moving to these food clubs and hopefully to the food pantries when we find the right venues is the way forward. And so thank you, because I think seeing it like this actually, you know, I might not pay more attention because I always pay attention. But actually seeing it like this really does highlight the exceptional work, because it has been exceptional in this last 18 months. To think that we've been dealing with a pandemic and delivering on our 50 steps, I think is exceptional. So thank you to you and your team and to all the others who've contributed to the success of 50 steps. Thank you.
Brilliant.
Thank you, Chair. I think Sarah has stolen my thunder.
Good.
Clearly, this is a great piece of work, and I think I would like to congratulate Jason and our other partners who have equally worked exceptionally well to not only day job, but also making sure that these 50 steps are developed, monitored, and implemented. And if you look at the achievements for each of those priorities, the tremendous amount of work that's not only been done by us, but also our voluntary sector and faith sector partners in the community. This does create a buzz, and I'm sure when this is launched, there will be a good contribution from the residents as well, who will acknowledge this. So I will join Sarah in thanking you all for this excellent piece of work, and we look forward to making sure that this is a continued success. Thank you.
Thank you. Councillor Colin.
Thank you. I'm not going to say anything that they've already said, but I will say that actually this is an amazing piece of real co-production and working in partnership, and actually something we should really be proud of. I think when we all sit down and have these meetings in regards to the policies, the strategies that we have going forward, we don't really see what that may look like for the resident, but actually this is a real great opportunity to see what we've done so far and how much has been invested in the well-being and health of our residents. So I, again, like my fellow councillors have said, a complete hats off to everybody that worked on this project.
Colin.
Thank you, Chair. Yeah, so I just want to add, in one of the, and I'm not going to repeat everything that everybody else said, but what I would just want to, just in terms of having a health and wellbeing strategy enables us to have common goals and achieve together. And what that's enabled us to do by the 50 steps, and colleagues from health are on this call, and we've been using that as a guide for all of the work we're doing as part of the NUM executive, the work we're doing around DICS development, gives us an anchor back to the things that we feel as a health and wellbeing board are the important things that we need to achieve. And I think this document, does highlight the work that's going on behind the scenes by officers, the NHS, by the voluntary sector, because we've got a common theme and a common goal, and this is what we're working towards. And it also, from a policy point of view, then anchors back down towards a better NUM recovery strategy, and everything flows through that. So, thanks to Jason and his team for putting this together, but also thanks to Health and Wellbeing Board to agreeing to these as our priorities, because we're making real strides in this. And it's really helping both us as an ICS development and from a health partnership to really drive through the things that are important to this board.
Thank you, Colin. Jason, at our session in December, that'd be an opportunity for a little bit of is that more a show and tell, or is it an opportunity to start a little bit of a refresh, because we have?
So what we're going to be, the plan for the 9th is to talk about with community, with our change makers, with our engaged community, to talk about some of the wicked challenges that we have across the different priorities, but also to make it very immediate, because I think we have, also as part of our recovery and coming out of COVID, a whole range of immediate health challenges that we want to engage people around. We do think there's we always said when we published 50 Steps that it was not kind of set in stone, and it needed to be evolved and updated to reflect changes. So I think we have had a discussion about, we don't want to do big extensive, but we do want to just go through and say what's changed, what have we achieved, and we can kind of tick off, and where are the kind of next things that when we finalised this draft, maybe weren't quite as high as on our agenda and maybe have zipped up. So we'll be working on that. But any thoughts that people have, please, as ever, get in touch, drop me an email, thoughts you have, that would be, and then obviously we will bring something back to the board at some point on that.
Brilliant. I can't see any virtual hands, but well done. Item 7, Jason?
Which is item, sorry,
COVID. We can't have an agenda without COVID.
Jonathan.
Yeah.
So this is the health impacts and recovery planning. So something strange, apologies to the board, I'm not quite sure why, but there's a very, very extensive piece of work that's been done on the wider impacts, the wider health impacts and wellbeing impacts of COVID-19. A very, very extensive piece of work. And to go with that, Adiola and John Rook had also drafted an action plan to say these are the things we've identified as the issues, and this is what's going on, and this is where the challenges, some of the challenges are. I don't know why that wasn't circulated.
Good, I expect, Jason.
Sorry?
Too good.
Too good. So what we're going to do is this. After the meeting, we're going to circulate the data pack and the action plan. There's no, it's way too extensive to go through it in detail now. We'll circulate it. At the next board, we'll have an updated action plan because things move on over the month. So we will update that for the next board, and we'll give proper consideration for the data and the action plan at the next board. But what I've asked Addy and John to do is just to give a few highlights from that work, to just share with the board where we think some of those challenges are as part of wider COVID health recovery and some of the things that are going on in that space. But we're going to have a short discussion on it now and a more extensive conversation on an updated version at the next one.
Okay. Hi. Thanks, Jason. Sorry, my video's off. I've not got great connection, so apologies, but I hope that's okay. And again, apologies, the data pack didn't get published, so we'll look into that and see what went wrong there. But so yeah, just to highlight a couple of kind of key impacts just to draw attention to. So long COVID, we have had several referrals to the North East London integrated multi-assessment long COVID clinic. So we know sort of nationally something like 14% of people with confirmed COVID have sort of 12-week symptoms of long COVID. So we are looking at sort of substantial numbers, probably several hundred people with long COVID, so that there might be a little bit of a gap in terms of numbers with long COVID and referrals. So that's something that we certainly want to look into. Some of the other key things, so impacts on immunizations. So the good news really is that coverage didn't, in the long term, didn't really suffer. We had some really innovative models of delivering child IMS through COVID. Some IMS were given a little bit late, but the coverage was maintained and recovered really strongly. In terms of families and children, so we've got some interesting information in how families responded to the educational challenge and play opportunities. And we certainly see some inequalities in there. So some of our Black Afro-Caribbean communities certainly reported some particular challenges in accessing play opportunities, for example. So this is some really useful information that we're using to help shape those services and help recover attendance at children's centres. In terms of screening, there's been some quite sort of big impacts, as you imagine, on cancer screening services. Referrals were certainly down while services were shut over a period. And there was something like a 42% overall reduction in referrals to national screening programs. We're now kind of working through what that might mean in further detail, trying to understand how numbers of cancer diagnoses and staging of diagnoses may have been affected. But we saw some sort of quite big impacts, colon cancer screening particularly, cervical cancer showing about a 6% decrease. And then in some of the other kind of wider impacts, so we had substance misuse impact, so where numbers starting treatment dropped, but treating completion improved. Some impacts on obviously lots of mental health, suicide, self-harm, where we did see a slight increase in suicide, but again, still small numbers. And some of the economic effects, obviously there was a big increase in claimant rates. So we had a 3% increase and over 25,000 residents impacted, and the highest uptake of furlough in London, over 28,000 residents. And then quite a substantial increase in Eat for Free eligibility from 20 to 30% as a result. And then one of the other things to highlight was something like a 4% increase in domestic abuse. So that was something in the region of an extra 80 cases that were picked up and referred. So as Jason indicated, it is a very detailed, long slide deck. So look forward to sharing that with you and thinking through some of the impacts now. And then this needs assessment work has then led into the recovery planning work, which Adeola and John will now just give a high level outline of. Thanks, Chair.
Thanks very much. Thank you, Chair. So I'm just going to start with the, as John says, the sort of high level action plan. There's a 14 slide pack that will be winging its way to you after the meeting. We've picked out some 10 or so key priority areas to look at for action and split it into two areas of focus. One where there are actions that are in progress already, either because they're an evolution of activity that was already happening. So for example, around some of the upstream risk factors, or whether because that they are in progress as a result of action as post-COVID and as part of COVID recovery. And the second part of the pack is the inequalities lens that we're bringing to all of this, that one of the most marked impacts for Newham of the COVID pandemic was the disproportionate impact across communities of the disease itself, but also it highlighted underlying inequalities in both access to and outcomes of services and health outcomes and life expectancy in general. And it's important that we continue to maintain our focus on addressing and reducing inequalities across for our residents in their long life expectancy and in the outcomes from services. And we have a number of attendant programs that are looking at doing just that, but we put in the inequalities focus as part of this pack. So just as John mentioned, for looking at long COVID is brand new. It obviously came along with COVID. There is, as John said, a secondary care service hosted by ELFT, and we have some data from that. We also know that immediately from the get-go, there's a disproportionality in the number of people in the uptake and access to that based on ethnicity, and some more work needs to be done to understand this a little bit, but also to ensure that that residents have the same opportunity of access to that service and opportunity of access to the information that they need to support them around persistent symptoms of COVID to help manage those. But that will be an emerging and evolving area. John also mentioned some interesting issues around cancer. Cancer prevention and screening persistently pre-COVID and post has ethnic inequalities in it. That uptake and access to screening is always disproportionately worse for men and for people of colour. There are some particularly striking data in the data pack showing a persistent disproportionality in the access to early diagnosis and treatment for Asian women and men of African descent. Which is something that I think existed pre-COVID, but is something that has been, again, put into stark relief and is something that we want to look into and address with our partners. Looking at also at, there will be some substantial impacts for our health and care system around resourcing and recovery that we have manage the pandemic on a degree of focused, targeted, short-term money. What our situation looks like going forward is something that is our partners need to have, will be looking at the economic impacts and some modelling about what our likely service impacts are going to be. There has already been a change in the pattern of care delivery as more care happened at home, but also people who have more complex care needs than was seen prior to the pandemic. And the impact of conditions which where diagnosis was deferred, and the conditions are people are in worse health conditions than they would have been had we not had the pandemic and any delays to care. In terms of acute service access, that A&E and general practice access are back to pre-pandemic or above pre-pandemic levels, and that dip in service access has now rectified itself. But again, there's always work to be done around leveling the playing field. And then finally, we've got there are 4 slides that look at the underlying risk factors, so things that would be called long-term conditions, or the risk factors that lead to those long-term conditions. So again, these are areas that will be held by the 50 steps, but there are issues around air quality and lung health and stop smoking. There are different figures for how people quit during COVID or how successful they were, but the air quality agenda is one that is urgent and contributed to COVID deaths and continues to contribute to diabetes deaths and other heart disease deaths. There are the underlying factors around diet and healthy diet and healthy weight, and the management of long-term conditions, both of which have had a lot of input in during COVID pandemic, but because they are so important in terms of prevalence for our populations, it's something that we need to focus on. And again, within inequalities lens, making sure that all of our residents have access to the same chance of a good outcome as each other. And again, thinking about vulnerability, one of the other the headlines around digital inclusion, the impact we've seen on rough sleepers and communities without recourse to public funds. So those that are the most marginal in most marginalised in our borough have also been disproportionately impacted, but the particular issues have applied to those various of those communities that were highlighted during COVID, and work is continuing to in those areas. I shall stop there, and I look forward to coming back with updates and revisions when you've had a chance to read through and digest 2 rather comprehensive slide packs, which sadly you're missing this evening. Thank you.
Thanks, Jonathan. Thanks, John. Jason, I was gonna. There's tons in there.
Yeah.
I mean, a lot of it, some of it's much more sort of urgent and a priority than some of the other, but I mean, it's all relevant and important. There's a lot of work, conscious that we're still in pandemic times. How are we going to sort of look and come together to some solutions to take action, some of this? I think that's the key thing, isn't it? I mean, we'll all have a look at the pack, but we absolutely recognise that there's some really, really key things here and some inequalities that have been identified that we need to sort of action going forward. And how are we going to bring this all together? How are we going to bring the team together to be able to do all of this?
I mean, I think that's, I think there's a big challenge for the new exec, really, isn't there? I mean, it's about, a lot of that is about our integrated care system. It's recognising that on a lot of things relating to chronic health issues, the challenges of 18 months of kind of, there's a mirror from the oral health discussion in lots and lots of aspects of chronic physical health and mental health.
Yeah.
And how we best work as a system to support people's reconditioning, people's access to preventative care, people being on top of, supported to be on top of the management of chronic conditions. So, there's a huge amount in there, and I think, I don't know.
There's stuff that we can do, we can refresh, we can review, make it more impactful, absolutely. But I think there's a big resource element that's going to be needed to be able to do this financial and people power. Councillor is.
Just really, that if we are going to have a discussion on this report, can we please ensure that we have either less items on our next agenda?
Yeah, with this.
Because, you know, we are struggling this evening. It's almost 9 o'clock.
Yeah.
We still have got some
chunky stuff
and we really do need time to give this report the due respect it needs. And I would rather have nothing else on the agenda apart from this.
Yep.
And I know that that's asking an awful lot, but you know, we really do need the time to give to the report.
January.
I thought Jason said something about December.
December's the 50 steps.
All right.
We'll circulate the report that should have been, but
January,
the substantial items.
Clear the agenda and have only other urgent, but we do need to give real due consideration to this report.
Mayor Fires.
I just picking up on, well, 2 points I wanted to make. Firstly, just picking up on the Sarah point. I don't know whether or not it warrants another meeting before Christmas, just given the seriousness of it. I appreciate there's been probably lots and lots of conversations at office. There needs to be equally the depth of conversation and interrogation by members that are part of our accountability responsibilities and being held accountable. And I think it also leads me to just a sanguine kind of presentation and the almost impossible kind of sigh by way of response that I picked up, just the scale of the challenge. And I think it just illuminates why we should remain absolutely on point with putting the pressure on the system, because it, you know, frankly isn't acceptable. We've had it with regards to oral health. It will be exacerbated more as a consequence of all the delays in the recovery strategy, which isn't going to be even likely, not even going to be bringing us back to any semblance of what we were pre-COVID-19, and how that will exacerbate ongoing issues around health inequality, further exacerbating the impact of COVID-19 and and the recovery planning. And I just think we're on a hide into nothing, to be quite honest. And I don't mean to sound negative. That's certainly not the intention. But it's, you know, I guess what I'm trying to say, I'm just a bit bored of having conversations and circular conversations and nothing seeming to sort of progress. And I'm bored of having conversations with people in positions of power within the wider NHS piece and just leaving those spaces feeling as if, you know, it's got into one ear and out of the other, because I just can't see demonstrable change and shifts. And I'm bored of hearing about, you know, the partnership's going to deal with it and then don't really get access to the regularity of the granular data so that we can do the challenge and accountability bit that we're elected for. Yeah. So I trust that what I've just said is taken in the spirit that it's intended with, and which is underpinned by a huge amount of respect for, you know, what everyone does and has been doing during a really, really difficult time. And I guess I'm expressing my frustrations with the wider sort of system as opposed to any individual here. Thanks.
Thanks, Mayor Five. John.
So what I think is achievable is for us to really look at the action plan that we've created for this and recognise I think it does need further time to look at, many of which of those actions are underway and I think are well within our gift to resolve. I think to add to some of the realism of Mayor Fires, we also going to be very closely in moving from a very troubled autumn into winter, which will put greater demand on all our resources and energies as well. But that doesn't mean that we shouldn't lose our focus from the recovery and improvement against many of the things that John and Addie outlined to us, plus also some of the aspects of mental as well as physical health we touched on earlier. So I think it'd be great to return to the action plan that we can conduct on behalf of the Health and Wellbeing Board and take confidence in those areas we really can get going with.
John, can I just ask, how aggressive can we be before the next time we come together, taking into account that the data will go out to everybody and coming back with an action plan with solutions and progress on areas that you've already touched on, we've made progress on, and put some timeframes on some of this? Because, you know, the urgency of this is absolutely important. I mean, is it something that we could come back to within 4 weeks, or do we need, how realistic is it?
So I think, let me give you a guarded answer. Some bits are easy than others. So I think we've got some elements which are longer term insoluble issues that have been exacerbated by COVID. Some of which are about us just restoring and recovering and working down waiting list backlogs. Some of which are long and some of which are not as challenging. Some of which are around communications and engagement with people around the resumption of services that we need to do. So I think you will see a blend in there. What I think we could commit to do is to say, these are the actions we're taking and these are the gaps that still remain. These are the areas that we think will take slightly longer. These are the areas where we're challenged with either human or financial resources. So I think we can have a healthy, thorough debate about the progress we're making and challenge ourselves to whether that's sufficient.
Okay, so debate before next meeting and then update at next meeting? Does that give enough time for members and for all involved?
So what's?
So, I mean, so there's clearly urgency around this. There's some sticky issues as well, just like the dentistry stuff, that obviously we need to present on the table, and we'll need to take a different kind of approach, an escalation. There's some stuff that's in train. An update for next Health and Wellbeing Board, I think, is absolutely what people have asked for. But then some work before that session around some of the solutions on this, and some discussion and debate around some of those areas and those gaps.
Go for it.
Yeah, I was just going to say, I mean, I think in terms of the plan, yes, because I think the plan for action was already there. So I think it's an expansion of that, I think, as John's described. So I think we can do that and get that out to the Health and Wellbeing Board and like you say, do that groundwork before we come back, so everybody gets good sight of that and we can see the progress that's therefore been made.
And I think we just, as John intimated, you know, we need to be honest about the financial and the workforce challenges that the NHS are facing. Yeah. And some of, you know, there are limits to our short-term ability to influence that. We need to, I do think, and we've discussed this before, need to have conversations about what position we take as a borough in terms of those long-term resource challenges.
Chair.
Is it okay for members if I move to extend the meeting?
Thank you, Chair.
Yeah. Oh, yeah. Literally a few seconds left. Jason.
So that's, you know, that's a challenge, and then, you know, where we can use creativity within our existing resource constraints to try and mitigate some of the challenges that we have. But, you know, that's building on the work, a lot of work that people are already doing in the system. Yeah.
Mayor Pfizer, is that an old Dr. Vade?
Thank you, Wax. This may just be going off a little bit of tangent quickly, but it's just to mention something that Mayor Fires mentioned about sort of what's being discussed at the partnership and where we're there, you know, is everyone having sight of things that are outcomes, etc. And I do know that we need to continue having those discussions around sort of the governance side of things. I know we'll be having that on Friday, so just to show Mayor Fires that we are having those discussions just to ensure that the accountability, etc., is being looked at, and we come up with a robust plan that's going to work for Newham. So that's just for assurance. Thank you.
I think some of that delegation is important, but we also need to be cognizant about where decisions are actually made. So we've heard the example about dentistry where we get stuck.
Yeah. Can, Chair. I mean, and just to say, it's not even just about NHS funding. It's also about social care funding, for example.
Oh yeah, it's,
you know, so
it's in, isn't it?
Yeah, it's the whole system, and some of those are longer term, and I think that would be a good example of stuff that's really a little bit outside of our control until we get further clarity.
Well, it's clearly that money's an issue. I mean, it openly said it. I'm not going to do anything because I haven't got any money to do it, and I haven't got the power to do it. That's not helpful for us. That's not helpful for, you know, the children that need the support with oral health. So in our system, we need to think about how we cut up that wedge based on our population health needs. And we need to move into that space and very, very quickly. So one thing is about delegation, but it's also about being understanding about where decisions are actually being made and actually having those conversations at those levels, which enable us on the ground to make those transformational changes.
Also being creative in terms of what we do and what we do have and how we best utilize it in terms of meeting the future needs.
Should have given Boris a list when he came to a lovely place.
Well, I did.
You did,
I did. And we'll have some advisors come back afterwards, which is what we need to do.
If I can, sorry.
No, go.
I just wanted to make just one more point on that. Just as an example, the Better Care Fund is on the list for tonight. And you'll see in that report that one of the areas that we've worked as a partnership around making investment in is the 50 steps: inequality, prevention, transformation. Now, I think that to me is where we can start shaping the investments that we need to make. And that's work that we've done across the partnership to put money into the 50 steps, but that also links to the COVID recovery also. So I think that's where the mandate from the health and wellbeing strategy, the COVID recovery plan, is driven in those areas to make sure that we can find some investment. It's not the whole investment that we need, not by a long way, but it's starting to move it in that direction.
We absolutely need to take finance along with us.
Yeah, absolutely.
So for every organisation, you know, finance need to be part of that strategy. Yeah. Otherwise, we're going to hit obstacles in the way.
Exactly.
Only thing I just want to add to everything that's been spoken about, and we'll go back to the previous agenda item that caused a little bit of contention. I guess my only ask would be, what does this actually look like in real terms? And whatever we write on paper, is it actually what's happening on the ground? And so just to make sure that those examples, that, you know, the strategies, the things that we're saying are actually happening when it comes to the people here of Newham, because I think that's sometimes where we have a complete disconnect, because what we heard today was there's no issues. Well, we all know there's issues. So it's just, for me personally, from a layman's point of view of what is it that we're saying and what is it our residents are experiencing, and how we actually mirror that up in regards to impact of anything that we decide that we're going to be doing. And I totally agree with what you're saying in regards to finance.
Well, and that on that point, that residents and patients, what they're saying and what our health watch is saying, what our advocates for our patients and residents are saying, we need to keep that communication channel open all the time. Brilliant, excellent. Tim, are you taking send? Thank you.
I thought you were going to ask whether he was taking notes.
Yes, Chair. I'm just going to say a few introductory words, and then Jessica Ewan, who is the head of SEND, and Stephanie Connolly, who's one of the improvement leaders in children's services, will take the paper itself or any questions. So just want to say we thought it was really important to bring an update to the Health and Wellbeing Board on special educational needs and disabilities. We recognise some of the really significant challenges that we face in ensuring that we are delivering the right standard of services in this area. And we know that impacts on the experiences of children and their families. And we also know that Newham as a local area was slow in implementing some of the 2014 SEND reforms. So we've identified that need for improvement. I think it's fair to say there's been very significant activity over the last 12 months or so, including some significant investment to ensure that we've got some really clear improvement priorities and a strong focus on what we can do to improve services for local residents. You'll hear in a moment about the Commission into Special Educational Needs and Disabilities, and that's really been brought about to bring key stakeholders together to understand the experiences of individuals and families and to help shape a new strategy through a process of co-production. So we have an imminent joint area inspection by Ofsted and the CQC, and in preparation we've been conducting a self-evaluation of services, and I think that's given us a really strong idea of the gaps and the areas for improvement, but also some of the emerging areas of good practice. So, Chair, I'm going to hand over to Jessica Yuan, who's going to just take us briefly through some of the slides.
Thanks, Tim.
Thank you very much. So I'm going to take these slides as read and give a kind of a relatively high level overview. But the slides in the pack cover the Newham context, how well we identify the needs of children with SEND, and how well we assess and meet the needs of children with SEND, as well as how well we do in delivering positive and successful outcomes for that cohort of children. So the Newham Local Area Partnership is made up of a committed group of partners. And as you know, you'll be well aware, Newham has a long and rich history of inclusive practice where children and young people with special educational needs and disabilities are largely supported within mainstream school settings. Despite this, the Local Area Partnership didn't respond to the SEND reforms in 2014 with quite the rigour and pace that was required by the Act, and that was for a whole host of reasons, but that does go on to sort of present some of the challenges that I'm going to reference this evening, and it goes without saying, as sort of all presenters this evening have really cited, that COVID-19 has also had a significant impact in the SEND space, particularly around timely assessments and diagnosis. So, you know, certain demographics make Newham quite unusual. Newham has a high population of 0 to 25-year-olds, which does, you know, drive up the level of need. We have in secondary schools the highest rate of profound and multiple learning disabilities. And in primary schools, we have the highest, twice the national average of children diagnosed with autistic spectrum disorder. So we do have, particularly with those two diagnoses, very high rates. And Newham, you know, is responding to that. We have 27 resource provisions and annexes in place. We have the Year of the Young Person in 2021, and kind of, you know, more campaigning, which is helping to resource and mobilise our resources for children and young people. I'll just talk briefly about some of our strategic drivers for change. So we need to do a whole host of things, and partly because we do have this high level of need, and partly because we didn't implement the reforms in quite the way that the Act required in those early years. So we need to fully and effectively implement the SEND reforms. We need to accelerate improvements in timeliness and quality of our education, health and care plans, completing overdue assessments. We need to make a cultural shift from providing support and services too late, and really improve our early help support. We need to develop our local specialist provision. And we need to get better at working with children and young people and parents and carers at an individual level, not just through strategic forums. So really making sure that we are co-producing our outcomes on a child and family basis, just as part of our routine good practice. I mean, I won't sort of run through that all of those elements, but there are a number of things that we need to do and that we have built into our improvement plan. Also, in December 2020, the Newham SEND Executive Board reviewed its priorities and our progress against Newham's Best for All strategy. And that brought out a number of priorities. Each is supported by bi-weekly partnership work streams that focus on operational challenges that need to happen to deliver change, and they include supporting statutory assessment. We have a new governance structure which has within it a number of really positive focuses, and one again is around EHC performance and timeliness. We've made progress since January 2021. As Tim sort of indicated, investment and focus on really driving improvements in this space. So one of the things is that the EHC assessment timeliness did improve from 5% in April to 76% in September. We do have a long way to go, but there are indicators that we are starting to head in the right direction. And we've also seen additional investment in our autistic spectrum disorder pathway to reduce some of those waiting times. And we've reprofiled our high needs funding deficit recovery, which includes additional investment into education psychology. And that's in agreement with the DFE. So to have it across 6 years, which is ambitious and realistic at the same time. That we are increasing our co-production activities within a sort of you said we did framework. I've provided in the document a number of examples of that, where we are listening more closely to what children and families are saying to us. As an example of this, in October we ran a taster session which promoted inclusive leisure activities. And that brought a number of families together to learn more about support offers, to learn more about affordable and accessible resources that families can bring into their homes, and also to give children and young people taster sessions in things like wheelchair basketball. Again, as Tim has said, we are expecting a local area inspection quite imminently, and that will be conducted by both Ofsted and the CQC, and therefore the partnership is working together in preparation from that, and to kind of maintain that impetus to continue to improve performance. And the inspectors are going to look at a whole host of things, including a focus on improved outcomes. How effectively are we working together as a partnership to improve outcomes for local children? there are three sort of inspection themes that I'm going to touch on very, very briefly. One is about the JSNA. So one of the strengths in terms of early identification is that we have a better understanding of need thanks to the JSNA. An area for development in early identification is to continue to reduce diagnostic waiting times for ASD, given that we have sort of double the national average in our primary school of that particular need. And the next step is really to develop our ordinarily available offer and our inclusive practice framework to support practice in all schools in the most systemic possible way. Another inspection theme is around assessment and intervention. So we have a strong, and I think we kind of gathered some of that from the CAMS presentation earlier, a strong social and emotional mental health graduated offer from our NHS trust provider, and also commissioned COOF and Head Start, for instance. So that is a strength within the borough. One of the areas of improvement is about, embedding some of that multi-agency work with children and families at the inception, so at the early stage of the assessment process, to make sure we are co-producing, we're listening to what families want, we're identifying the goals that they want to work towards, and then we are supporting that journey. And next steps in terms of assessment and intervention, it goes without saying, includes the delivery of EHCPs and ensuring that we kind of remain on track with that recovery plan, because we, as I said, we do have a way to go. And lastly, another inspection theme will relate to improving outcomes. We have a strength in terms of improving outcomes. We know that the educational attainment for children in receipt of high needs funding is quite high compared to children with a plan nationally. But we know we need to do more to improve the educational outcomes of the children with a plan with more complex needs, including those with an education, health and care plan in borough. And again, just continuing to drive that outcomes framework. Tim has alluded to the SEND Commission. So we have a SEND Commission which is independently chaired, it's time limited, and the Commission is focused on what inclusion should look like in education and in society in Newham. We're really delighted to have Jeff Lindsay, who's leading independently that commission. He has an excellent reputation and notoriety. The format of the commission includes one-to-one interviews and evidence gathering sessions. We can expect the report in December. Some key themes from the commission are early identification of need, the voice of children, young people and families, statutory assessments and support, and funding and provision. And what I would ask the board members to consider this evening is firstly just to note our strengths, our areas for development, and the next steps across the local area SEND partnership. And secondly, I would ask that we could perhaps agree a further analysis of our SEND profile following the really helpful JSNA from Public Health, with a particular focus on our profound and multiple learning disabilities and high levels of profound multiple levels of disability, high levels of ASD, and relatively low levels of mild learning disability. So we can really better understand our profile of children with SEND in Newham, and then better target and tailor our services to meet those needs.
Chair. Yes. Chair, just before you go on, I think you've been handed a note, so I'm conscious of time.
Yeah, so we've got 10 minutes remaining.
Thank you, Chair.
Yeah, absolutely. So we'll keep points, the last two items brief, and any questions we'll keep brief as well. But Tim, you and the team have absolutely grabbed the nettles on this one. Really, really good work. And were there any comments or reflections? Colin.
Thank you, Tim and your team. I welcome this, and it's a long time coming. I think us knowing where we're at as a local authority is really important. And so I am extremely grateful for this piece of work and the attention to detail that's gone into it. But I do have a question in regards to Newham contents. The only thing I don't see on the actual page is actually the Newham contents in regards to children with disabilities, special educational needs. And I don't see that figure. And I would ask that was actually, I see the overall figure, but I don't see what that looks like when you break it down to actually children with special education needs and disabilities. And I would ask for that to maybe be included in that sheet, if that's at all possible.
So some clarity on the context and background.
Absolutely, Chair. And just for reference, we've got 1,880 children with education, health and care plans, just over 1,200 on high needs funding, which is a total of just over 3,000 children and young people in those two categories. But absolutely, you can add that to the context slide, Chair.
Thank you.
Thanks, Tim. Carly's just updated it for you. He's going to ping it to you. Okay. Well done, everybody. I'm going to. Councillor Reid.
Really, I feel like, because it does come into my portfolio, say that actually, if you'd have looked at this service 18 months ago, we would have still been quite ashamed of where we were, and the huge amount of work that has gone in since January, and probably a lot led by Stephanie. We now have a permanent, for the first time in years, permanent head of SEND, and we will be cracking on. And, you know, I think that the inspection, I don't think we should be frightened of when it comes, because we know where we are. And it's not going to, we're not going to get any better in the next 3 weeks. So bring it on. But yes, just thank you to the team, because this has been a real Herculean labour of love.
Absolutely, notwithstanding the pandemic, really, really great work.
Yeah.
Well done. Well done, Tim.
Or Health Watch, always last.
Always last.
Always first.
Hi, Julie. Julie, we've got 4 minutes for the last two items. Item 12 and 13 in a 2-hour meeting. Over to you.
She's thinking, huh?
She's frozen now.
Oh, she's frozen.
Chair, if I may, before you bring in our colleague from Health Watch, there's no way we're going to be able to give this serious consideration. We've only got a few minutes. And, you know, it's an important point for us to consider. I just wonder whether or not, in light of my earlier comments relating to needing time to consider and come back.
Yes.
And if we can make time to have another meeting before Christmas. I appreciate diaries can be quite challenging, but I just think we should give due regard to the work that Health Watch Newham do, not least because they're the voice of our local residents, and 4 minutes is quite disrespectful.
Yeah, absolutely, Mayor Fires. But we should be able to find some time in December. Absolutely. Is that okay, Julie?
Oh, Julie sat through all of this.
Yeah, I mean, we had some.
No, that's fine.
No excuses. There's plenty of chunky items and things that we really need to get sorted. So, but thank you so much for your patience, and we'll absolutely get some time in the diary. Colin. Literally,
if I can literally,
yeah,
in a few minutes, I will. So thanks everyone for allowing this to come along tonight. And I really don't need that long to explain it. I think most members are aware of the Better Care Fund. know that it's is ambitious in its approach. So you can see that it's in terms of the value, it's 156 million. Strips anything in London. If not, this is probably one of the largest pools nationally. And it's really there as a lever to support the ambitions we have around our health and wellbeing strategy. It protects social care, and it's really a lever for making things happen. So for the last 2 years, the Better Care Fund has really just rolled over, and that's because for numerous government reasons, they have not quite decided what to do with the Better Care Fund in the future. But speaking candidly, we were expecting those arrangements to roll forward, and then the government said, you have to do a plan and you have to submit it, and you've got about 2.5 weeks to do it. So, so what you see in front of you, a glossy version of what we would want to do. It actually just follows the template they've given us and the expenditure spreadsheets. However, what I do want to point out are 2 key items that have been added to our Better Care Fund. First is around our integrated discharge hub. And that's a commitment from the CCG to continue to fund the social work elements of that. And the second one I mentioned earlier is around our 50 steps and additional funding to fund prevention and to tackle health inequalities that we have. So as a practical example, going back to Councillor Lee Parkway's, what are we actually doing? That is funding vitamin D rollout for this year. It's funding health and weight management. It's funding smoking. So it's all funding a lot of these things. So it's a real
Dental care.
Definitely not dental care, Councillor Ruiz, but it's trying to move and shape it in the right direction. It's now going to go off for the submission was yesterday at midnight, and so we brought it here to the Health and Wellbeing Board today. It will now go through an assurance process, and we had regional assurance, and it's already been fully approved. So it's really a rollover, and the plan being is when the new Better Care Fund, whatever shape it takes, comes, we want to link it very closely into our health and wellbeing strategy. So
thanks, Colin, and thank you for being brief. I can't see any hands on the virtual. With the Health Watch item, can we bring these 2 items back for a meeting in December?
This one?
Yeah, because this was tabled today, wasn't it? So I'm not sure, have colleagues on the...
Yeah, it's been circulated.
It's been circulated.
Yeah. It's at this point, we've been the final version back in January. So this is initial approval so that we can go back to NHS England and say we've got initial approval, and then we'll bring the final one back here.
Okay, and have colleagues virtually received that via email and had a chance to go through that?
Has been said.
Yep. And are we happy to approve to bring back for January?
Yeah.
Yep.
Yes, Chair.
John?
So, Chair, I was just going to say, yes, we've gone into quite a lot of detail in the planning of this. Brilliant. And seeking the endorsement today of it, given the comments Colin made about the timescales we've been under to achieve.
Yep. Okay.
Thank you.
F5s, was there anything else? So next meeting's down in January. Absolutely important that we put a time in the diary for December. It doesn't have to be the full 2 hours. We can pick that up offline, Jason. Thank you all for your patience. I think we covered plenty of some really wicked issues today, and I thank for those that joined us on YouTube and those virtually. Thank you all to those in the room, and we'll look to see you in December and then in the new